In this video, we're going to continue our discussion of Chapter 25A notes, again, looking more specifically at the anatomy of the digestive system. Here in video 2, we're going to look at specific organs going from the mouth to the stomach. So in the mouth, also known as the oral cavity or the buccal cavity, is going to be lined with a mucosa of stratified squamous epithelium. It's thicker, so it withstands abrasion better. Carries out mechanical digestion through mastication, chemical digestion carried out from secretions by salivary glands, and propulsion. Now, we're going to look at this in a process known as deglutition, which is swallowing, and it begins here in the mouth, using the formation of the cheeks as well as the tongue, and then, of course, the pharynx later to assist with that process. Now, the tongue itself is going to be important for a number of processes, digestive, in addition to things like speech and taste. So when you take a look here at the tongue itself, it does have tiny bumps on it known as papillae. The only ones in here that don't have taste buds are known as the filiform papilla. And you can actually see those running here across the surface. You have the fugiform and the folate papilla, and those do actually have the taste buds that you think of sitting right there on the surface. We're not going to go into detail about which types of chemicals are tasted by taste buds. We're just going to make sure we know that these papillae themselves don't all have taste buds. That's the most important thing. Now, as you continue to look at the mouth itself, teeth are considered accessory organs of the mouth. And when you look at the structure of a tooth, you can see that it's pretty complex. Now, teeth are not bones, right? Because they don't have the same kind of distribution of substances, but there's a lot of similarity there. Most of that similarity is found in the enamel. This is considered the hardest substance in the human body, and it's going to be a densely packed hydroxyapatite. This is the same kind of a complex that makes your bones hard, but again, they're missing all the collagen fibers that give our bones a slight amount of flexibility. You'll see what's known as cementum, an extension of this, covering the root and protecting it. Right? So of course, then you take a look at dentin being the next level, and this is going to give you some shock absorption all the way through the tooth. You're also going to find that that tooth itself has to be anchored into this socket. Sockets are known as alveoli, and that's done by what's known as a periodontal ligament. And that ligament itself basically is a bunch of tiny fibers that run all the way around. And those fibers themselves are collagen based. So when you don't have the right nutrients, then those become weakened and teeth can become loose. And that's what you see in things like scurvy. The pulp cavity and the root canal itself running all the way from here and down, they do contain blood vessels and lymphatic tissue. And so whenever you have a cavity or a carie, as it's sometimes called here in the tooth, that does open up the potential for infection. So you can end up with a very serious systemic infection originating here from a damaged tooth. And so, of course, it's important to make sure that you have appropriate dental hygiene to protect these teeth because it's also protecting the rest of your immune system and cardiovascular system. Now with teeth themselves, you can see, of course, the division of the different types. Incisors is the front for cutting and nipping, the canines off to the side for tearing, and premolars, right, or molars is all that you would have as a child. That's for the grinding and the crushing activity. When you look at how many of each tooth you have, you've given a basic pattern known as a dentition. And so in a deciduous or a baby tooth dentition here, you can see there's essentially two incisors, two set of incisors on either side, one pair of canines, and you're going to have two molars on either side. And that dentition here is 2I, 1C, 2M, giving you a fourth of how many teeth you have total. When you take a look here at permanent teeth, there's obviously more. The head is growing, so there's more room for these teeth. You're still going to continue to see two incisors on either side and one canine on either side, but now we've got premolars. Premolars were not seen in the deciduous dentition, and now you have a third molar in some individuals known as a wisdom tooth. And not everybody has these, but that is wisdom tooth is just considered one of your three molars on either a quarter of your mouth. Now, if you assume the mouth and the tongue are helping you with mechanical digestion of food in the mouth, then it's time for you to start to swallow that food as you push it back to the pharynx. Now, one thing to notice here, first off, is that food gets called a bolus, which is such a flattering and charming word. It means a food pellet, but as you're chewing it and it becomes kind of sticky and thick, we call it a bolus. And so we're going to be looking here at deglutition, or swallowing, of a bolus of food. And so we've studied parts of the pharynx already in looking at the respiratory system, and some of this will sound so familiar because of that. So as the food or the bolus begins to move backwards, the goal is to make sure that it doesn't invade the respiratory cavity, and that's what the uvula is for, and that it does not enter the respiratory cavity. And of course, that's the epiglottis. And you can see that nice closing of the epiglottis right through there, making sure that food stays posterior, headed down the esophagus. Now, the pharynx itself is not a true tunic-lined organ in the same way the esophagus does, but it does have a nice band of skeletal muscle around the outside. And those skeletal muscles are known as pharyngeal constrictors. So the idea right here is that food, or that bolus, begins to be propelled downwards, and you have what's called an upper esophageal sphincter that closes and tries to prevent regurgitation of the bolus back up. Because as you can see, now the epiglottis is no longer blocking the airway. You would inspirate any of that food if that sphincter were to release. One last thing to note, you'll see here that this is skeletal muscle that surrounds the pharynx. Skeletal muscle provides voluntary control. This is why you can consciously control when you are swallowing. This is different from what we're going to see in the tunics of most organs, which is going to be smooth muscle, and that's controlled involuntarily. Now, as the bolus continues its great journey down the esophagus, it's continuing to come in contact with stratified squamous epithelium, preventing abrasion. You do have esophageal glands here in the submucosa, and that's going to lubricate the lining here of the esophagus, making it easier for the bolus to pass down. And what's interesting here is the muscle of the wall. It starts out first as skeletal muscle, completely voluntary, and then mixes here as a combination of skeletal and smooth muscle. But by the time it connects here with the stomach, it's completely smooth muscle. So if you translate that to control, swallowing through the esophagus starts out voluntary with skeletal muscle, and then is involuntary as reflexes take over the function of the smooth muscle. It, of course, joins the stomach here through the esophagus-stomach junction, and that's going to be surrounded by the gastroesophageal sphincter, also known as the cardiac sphincter. And that sphincter itself is going to prevent gastric reflux as the stomach begins to work. Now, this sphincter itself is reinforced via the diaphragm, so you can see the diaphragm right here surrounding the esophagus and the sphincter at that point in time. And this is not always a fail-safe mechanism. Heartburn results whenever that cardiac sphincter does not prevent regurgitation or reflux of food. And of course, if there is gastric secretion here in the food, that gastric hydrochloric acid can erode and burn the esophageal lining itself. In really extreme cases, you can result in a hiatal hernia, but that usually only happens if you've got something pushing against the stomach, such as what occurs during pregnancy. Now, with the stomach itself, we see the mucosa is pretty unique. It has a very wrinkled appearance. Those wrinkles are known as rugae. And here, of course, a big difference from what we've seen so far is the mucosa is now formed of simple columnar epithelium. Now, because there's going to be a lot of acidity here in the stomach, this epithelium has to be very protected. You'll find that there's a bicarbonate ion-rich mucus that coats the lining here. Now, you'll recall from the respiratory system that bicarbonate ions can function as buffers. They can help to bind to free-floating hydrogen ions and prevent them from creating too low of a pH on the surface of that mucosa. As we get a little bit closer, we're also going to see gastric pits. So we're going to move to the next image here so you can see this. This again shows you the rugae and the ripples of the mucosa of the stomach, and this is showing you those gastric pits. Now, we're going to spend a great deal of time studying the cell types of the gastric pits, but just know this is where all your gastric juices are actually produced. And of course, these cells themselves regenerate every 3 to 6 days, completely replacing the mucosa because of all this gastric activity that has to take place. One other thing you'll start to see here is there are 3 layers of smooth muscle rather than 2. And this is because of all the different angles of contraction you need to see with the stomach. So you have the longitudinal and the circular layers, but in addition to that, you have the oblique layers. Now, of course, when you talk about gastric ulcers, those are going to happen here in the stomach. Those tend to occur because of bacterial infection in many, many cases, and that's a bacteria known as Helicobacter pylori. And these actually can destroy this mucosal bicarbonate ion production. And so at that point in time, every time your stomach begins to digest foods, it's starting to erode itself. So typically what you do is you give a dual course of antibiotics to clean up the bacteria, and you give what are known as histamine blockers. And that's going to help prevent some of your hydrochloric acid secretion. We'll look some more at that a little bit later. So here's some review questions. Question 3 of Chapter 25A. Which tissue forms the mucosa of the oral cavity? Is it A, simple squamous epithelium, B, stratified squamous epithelium, C, simple columnar epithelium, D, stratified columnar epithelium, or E, pseudostratified ciliated columnar epithelium? Question 4. Which sphincter exists at the junction of the esophagus and the stomach? A, the pyloric sphincter, B, the ileocecal sphincter, C, the cardiac sphincter, D, the internal anal sphincter, E, the hepatopancreatic sphincter. That, of course, ends video 2. You can move on to video 3 whenever you are ready, and this is where we complete our discussion of Chapter 25A, running from the duodenum to the rectum.